Good afternoon, everyone. I'm Zhengsheng Li. Today, I'm going to propose a cloud solution for metro health, followed by a project governance. Firstly, I will provide a short introduction about the hospital. Nowadays, the needs of hospital keeps growing as more and more patients are involved. Therefore, many organizations decide to set up cloud computing to support large data storage and high bandwidth in the cloud system. However, some hospitals still apply outdated systems, and they have no hosting service and cloud environment, like Metro Health. As a result, the hospital needs to select a suitable cloud hosting server for its growing demand of data storage and bandwidth. And there are four types of data hosting models, including on-premises, public cloud, private cloud, as well as the hybrid cloud, which show as following. For the on-premises hosting, the data is stored in the in-house server or data center. It is often applied by the healthcare organizations to maintain a high level of control of the data. For its advantages, on-premises is easy to be controlled since it sits in a certain place, and it has a good compliance with the regulations of HIPAA. Further, it can be customized to meet the special needs, like adding the features, upgrading systems, and so on. Additionally, since the medical data is stored on-site, there is low latency and faster on the data performance. However, there are some defects of this model. The server has to be managed by the IT staff, and they also find it hard to manage and maintain. To implement this server, medical staff have to buy the relevant hardware and software, which is expensive and time-consuming. Besides, due to its fixed space and location, it has limited scalability on the data capacity. In this case, it could be vulnerable to incidents like cyber attacks or natural disasters, making the organizations hard to recover and back up the data. And now let's move to the public cloud. It is also called a shared cloud that can be accessed by each individual, including patients, clinicians, healthcare organizations, and so on. The medical and patients' data in these situations are stored in real time. For its benefit, it is obvious that public cloud is more flexible and scalable, the lower cost than on-premise solution. In addition, since the data is stored virtually, medical staff can access data remotely, which can improve the operation efficiency. And public clouds can also support the various types of data. But since it is open to everybody, the cloud may encounter some risks like cyber attacks, especially when there are more people and medical data involved. In this case, IT staff will find it hard to manage. If the healthcare organization has problems with lack of cloud knowledge, time pressure, and data capacity, the public cloud will be hard to implement. And for the private cloud, clinicians can access and store data individually, safely, and remotely. And at this time, the medical ICT infrastructure is dedicated to a single organization, not shared with others. The private cloud has several strengths as well. Similar to the public, there is no extra equipment cost for the private cloud. And compared with the public cloud, it also has a high level of data security, reliability, and recovery. So clinicians can focus more on treating patients instead of the computers. And what's more essential, it has high data sovereignty. Any data in the hospital must be kept in Australia. Plus, the private cloud also has the data availability to host on-premises within the healthcare data center. However, its cost will be higher compared to the public cloud server. And it cannot obtain any medical data linking to the public cloud. And due to its isolation and independent feature, other people cannot access the data, which is not good for data sharing. As to the hybrid cloud, it is an integration of both public and private cloud environments, which not only creates a unified infrastructure but also leverage the benefits of both clouds. Under the environment, The healthcare organization must provide a stable network and effective management tools for monitoring and controlling the medical cloud system to ensure the smooth performance. The hospital may find it hard to implement since it covers both cloud environments and they require integrations and durability with each other. Though it is challenging to implement a hybrid cloud, it has also many benefits. Like firstly, it is flexible to use since there are two clouds available for the medical care system, and the cloud can also support data transfer between both clouds, which can facilitate communication and interaction between two environments. Once the data is ruined or destroyed, its robustly disaster recovery will help data restore and recover from the offsite, ensuring the consistent operations. Besides, it will be less testing on the cost. And next, after analyzing all the servers, it is considered that the hybrid cloud is the best solution for Metro Health to apply. And since it has more convenient to and Android to support both the private and public clouds in the health system, it is found that the hybrid cloud is driven by CC, and one critical factor for the application is the bandwidth. The more bandwidth available, the faster data transmission and storing in the cloud, like the patient's EMR, physician's order details, PACS, and so on. As well, the performance will become better in this case, so staff like healthcare providers, drug researchers, and clinicians can better collect and share data. Another factor is the data security and compliance. By implementing hybrid cloud, the organization can store sensitive hospital on-site or in a private cloud, and it record common healthcare information on the public cloud to better protect the valuable assets and achieve the full control of the data. Therefore, combined with its benefits, hybrid cloud is the optimal solution. The following is about the governance, with the aspects of role matrix with 6 tasks and 6 roles, which are healthcare organizations, CIO, clinicians, senior management, IT staff, and project management. And CIO has the right to many tasks, including the risk assessment, trials for server, and additional support for the CC. For senior management and the project manager, they should have more responsibility on leading the project to succeed, like selecting a right server, overall performance of the system, compliance with the policy of CC, and implement the cloud system. Moreover, IT staff is responsible for conducting risk assessment for CC, and clinicians are responsible to train and learn new skills about the cloud and patients identification. Now moving to the next session, it's about the risk register. During the implementation of the project, the risk can be separated into 3 types, which are people, IT, and law. For people, there are 2 risks. One is reluctant to learn new skills. The other is the lack of skillful staff. Some medical staff are stubborn and unwilling to change, so CIO should motivate them by setting rewards and provide some benefits. And there could be inadequate IT staff to implement the CC, so PM can perform some training on them. During the implementation, IT staff should be aware of the risk of data breach, and senior management should pay more attention on the network connection. Now let's move to the Gantt chart and timeline for the project. There are a total of 5 phases, which are discovery, planning, analyze, and implement, testing, and the final delivery. The total time period of the project is around 3 to 4 months. From time to time, starting at the discovery stage, it includes conducting interviews with stakeholders and stage strategy assessment to obtain the needs of Metro Health. Then move to the planning. It will include the goal setting and training. And next we'll shift to the cost and analysis, risk assessment, and selection of cloud providers for implementation. The testing will including the fixing bugs, product evaluation, and final achieve to the last step and the rollout. And here are the top 10 references I found and relevant comments. I searched these articles based on the areas related to healthcare like cloud selection, cloud computing, EMR PACS, roles and governance, risk and timelines for implement CC. And that's all. Thank you.